Clinical Depression, Ethical Challenges and Solutions by Lucy Zhu and Tara Pittaparthy. Mental health is a crucial part of overall well-being, yet clinical depression remains one of the most misunderstood and overlooked conditions in healthcare. It affects millions of people worldwide, cutting across all age groups and backgrounds. Our team chose this theme because ethical challenges in mental health care can mean the difference between life-saving support and harmful neglect. We recognize the real barriers individuals face: stigma, misdiagnosis, and the struggle to access care. As future healthcare professionals, we want to understand these challenges so we can advocate for better ethical solutions that prioritize patient dignity, accessibility, and proper treatment. By expliciting this topic, we can shed light to the importance of ethical decision making in clinical depression care, ensuring patients receive the respect and resources they deserve.
Benefits for us as future health professionals. This project will help us better understand patient needs because clinical depression affects physical and mental well-being. Ethical healthcare approaches ensure compassionate and evidence-based care for us in the future. This also helps us in decision making in clinical settings. Ethical dilemmas include medication versus therapy, privacy concerns such as protecting patient confidentiality, and mental health discrimination in care facilities. Furthermore, it will help us develop healthcare leadership. Future professionals will encounter depression in all medical fields, and ethical understanding will enhance decision making and advocacy.
The importance to the target audience. We first need to define our audience. This presentation is not just for healthcare professionals, it's for everyone. Whether you're a student, a healthcare worker, or someone simply looking to learn, understanding ethical mental health care matters. Depression does not discriminate. It affects workplaces, schools, families, and friendships. For aspiring healthcare professionals, learning ethical practices now means better patient-centered care in the future. For community members, understanding depression and ethical treatment solutions can reduce stigma and encourage meaningful support networks. Every one of us can play a role in improving mental health awareness, advocating for proper care, and ensuring ethical treatment decisions lead to lasting change. The better informed we are, the better equipped we will be to create a healthier and more compassionate environment.
Data analytics. Clinical depression statistics. 5% of adults worldwide suffer from clinical depression. Mental health disorders are leading contributors to disability. There are also ethical challenges in treatment, such as accessibility gaps, millions lacking proper care, and the over-reliance on medications and lack of therapy options. Sources and organizations are from World Health Organization, NIMH, APA, and other credible organizations.
Seeking help for depression should be straightforward and supportive, but for many, it isn't. Stigma continues to push people away from accessing care, and misdiagnosis can lead to ineffective treatment. Parents might be prescribed medication when therapy would be more effective, or vice versa. Others struggle to find accessible mental health care providers due to financial barriers and geographic initiatives. Beyond access, ethical dilemmas arise in treatment decisions. Should medication be prioritized over therapy? Are patients truly given autonomy to make informed choices? How do we prevent discrimination against individuals with mental illness? Medical professionals must be trained to balance treatment decisions ethically, ensuring they listen to patients' concerns, offer options tailored to individual needs, and uphold principles that protect their dignity and rights.
Solutions and case studies. We have evidence-based practices that combine therapy and medications for comprehensive treatment and community mental health initiatives that improve accessibility. Case studies include examples from community-based mental health programs reducing hospitalizations and success stories of integrative care improving depression outcomes. Furthermore, there are challenges in future improvement that include encouraging ethical policies in healthcare and making therapy and crisis intervention more accessible for all.
So, where do you get this help? In-person resources. In a crisis, knowing where to turn a life can save one. Whether you're struggling yourself or supporting someone in need, immediate in-person resources can provide critical intervention. If someone is experiencing a mental health emergency, options include calling 988, the National Suicide and Crisis Lifeline, available 24/7 and free. Visiting an emergency room or psychiatric urgent care center, many hospitals have trained specialties for mental health crisis. Seeking help from local mental health clinics or community crisis centers that offer walk in support and counseling. Additionally, specific resources are available for veterans, LGBTQ individuals, and underserved communities. Access to compassionate, ethical care can make all the difference, and knowing these options beforehand can help someone navigate a crisis with confidence.
Where to get help, online resources. As talked, wait, huh?
There,
Okay. Wait, hold on.
we can edit it out.
Where to get help, online resources. There are crisis hotlines and text based support, such as the 988 Suicide and Crisis Lifeline. Call or text 988 and chat at 988lifeline.org. There are also crisis text line from text home to 741 for free and 24/7 support. There are also mental health support websites. For example, there are Mental Health America, which provides education and crisis resources. There are also American Psychological Association, which offers peer support and expert guidance. Lastly, there are special support for LGBTQ plus youth. For example, there's the Trevor Project. If you call 1-866-488-7386 or text START to 678678 or chat online. Furthermore, there's Trans Lifeline, which you can access by calling 877-565-8860 for peer support.
24/7 mental health crisis lines in the US. In moments of crisis, support should be immediate, accessible, and free. That's why the US has multiple 24/7 crisis hotlines available at no cost to anyone in need. If you or someone you know needs urgent mental health support, here are some lifelines. 988 Suicide and Crisis Lifeline, available anytime, anywhere in the US, via phone, text, or chat. Crisis text line, text home to 741 for confidential real-time support. Veterans Crisis Line, specialized help for veterans and service members. Call 988, then press 1 or text 838255. The Trevor Project, an initiative dedicated to LGBTQ youth. You can call 1-866-488-7366, text START to 67878, or chat online. Each of these hotlines is staffed by trained professionals and volunteers who provide judgment-free, compassionate assistance because no one should be alone in their struggles. Help is available no matter the time or the place.
The Trevor Project. This is an important project dedicated to mental health help for LGBTQ youth. Its mission and purpose being National Suicide Prevention Organization for LGBTQ youth, and it was founded after the release of the film Trevor in 1998. There are several services offered, such as the Trevor Lifeline, which gives 24/7 toll-free crisis hotline, and the Trevor Chat, which offers confidential real-time online messaging services for those in crisis. Furthermore, they also work in advocacy and education. They're dedicated to ending suicide among LGBTQ youth through policy and awareness. Furthermore, they provide educational resources and community support programs for youth.
So, our call to action. At the end of the day, what matters most is knowing where to turn for help, whether for yourself, a loved one, or someone in your community. Mental health care is a right, not a privilege, and resources exist to ensure people receive the support they need. Immediate crisis help, free and available 24/7, 988 Suicide and Crisis Lifeline. Call or text 988 Crisis Text Line, text home to 741 Veterans Crisis Line. Call 988, then press 1. The Trevor Project, once again, LGBTQ youth support, call 1-866-488-7366, text START to 678878. In-person or mental health resources are also available. No one should feel alone in their battle with depression. Help is always available and recovery is possible. And together we can create a world where mental health care is compassionate, ethical, and accessible to all.
Our evacuation plan and results. Our evacuation plan was to create a before and after test assessing people's general knowledge on health resources. We collected participants from our school, our peers, and students, and we gave them this presentation. But before they were received the presentation, they were asked a few questions about mental health resources. After the presentation, they were subjected to answering the same 5 questions to see if the presentation helped them understand a little bit more about mental health. And here are our results. Before, there was 50% of people who
911.
answered 911, and then 25% who answered 620, which are both incorrect answers. After, 75% were able to answer the question successfully, which showed a significant improvement in the before and after. Before the presentation, many felt that they were not confident in educating others about the importance of mental health and mental health resources, as shown in the low scores given by the participants. Afterwards, it showed a huge improvement in confidence, with many responses ranging from 8 to 9, also showing significant understanding and confidence in mental health resources education.
Thank you so much.
Thank you.